Okay, this is our ventilators. Hi, Ashley and Joel.
Hey.
They're here to show us their little connections here for the ventilator.
Okay, so we'll start from the beginning. So here on the side of the ventilator is the oxygen.
Yes.
You just feed it here. Then you have your exhalation valve, and that's this red piece.
Yes.
You connect that to the exhalation port.
Yep.
And then the transducer is fed from the top.
Wonderful.
Okay, so you connect that there, and that's on your transducer. Then this is to the patient, and this is gonna go on your gas out to the patient.
Okay.
This is your battery in the back, which connects from here.
Yes.
It feeds there, and then just plug it in. All right.
Now, I don't know if you guys are going to do it, but if you did want to filter this system for the patient, you could stick it on this end between the patient. So right here between the patient.
Yeah.
Yeah,
I mean,
there could be a filter. I
Filter.
can send you some
Sure.
filters.
If you're trying
Like
to
a
get,
viral filter.
if you're trying to get
Yes.
more life out of the circuit in case you may have to use it again and that's just how it is, at least you can yank the filter
Right.
and keep using the rest of this for a little while longer.
Got it.
So that should be a better option, especially if the patient has a lot of secretions and stuff. It's gonna go straight into that.
Got it.
Okay, so then when we turn on our vent, there's the multiple modes, but we'll just put it on AC mode. And we have a fake lung on there, so we
This
can
is just
see
a
it.
simulator lung
Yes.
that's going to be blowing up.
Okay, so here is our mute and cancel. We'll just turn that off. The only thing is there's some preventative maintenance, but these are older, but it won't keep alarming. If you lose pressures, the lines are probably popped off, or that just needs to be tightened up there. Your high pressures, you're gonna set, they probably know the stuff to set it at, but we usually do about 45, 50. The patient's more awake, we can set
And
it
it is
lower.
right there, so you can see
Yeah.
the number if you want.
And then the low pressure, we would set it like 5 to 10 just to make sure something's not disconnected and we're not noticing it. Then you can change your rate here, your eye time, tidal volume, and then you could put how much O2 you want to be feeding in. If they don't have O2 tanks and the patient doesn't need oxygen, you probably can just turn this off and you don't have to have this connected probably.
Okay.
Let me see actually if it'll work without it. Okay, so no, you do need an O2 source.
Okay.
So this is a pneumatic vent.
Okay.
It's like a normal transport vent. They work strictly off of flow.
Okay.
So, otherwise you can change settings and stuff. I don't know. Is this going to like a hospital that might know vent settings or nothing?
No clue yet.
Okay. So for you, Dr. Lowe, you could set your vent rate. You know we do between whatever the patient needs. You would probably just base it off of what
Their
you
weight,
think.
their ideal weight.
Yeah, and then you can just put their volumes. Obviously, if they have like really poor lungs, put your volumes a little lighter.
Okay.
For a normal patient, we generally just do 500. If you're just transporting its basic
And just
stuff.
be aware those knobs
Yeah,
are
that moves
extremely
real
touchy.
Yeah, like any little touch. So just be cautious here. But everything's set here, and then this is your pressures.
Okay.
So the peak pressure is 11 because that lung's fine. But if for some reason the patient has really poor lungs, but you still need to transport them and the alarms keep going off, you can make this a little higher.
Okay.
Or if they're coughing a lot, that's okay too. Otherwise, during transport, I don't think you would transition to these modes. Or if the patient just needs extra pressure, you could probably go to CPAP mode. If you want to pull the lung in and out. Joel?
Sorry.
Because it'll...
Trying to get it
Yeah, we could trigger a breath. So if the
Try
patient
to
just
trigger
needed
the
some
super
CPAP,
Oh, okay.
yeah. So he's pulling it, but if they just needed basically like a CPAP during transport, you could do that.
Perfect.
Okay.
And then as far as this tubing goes, obviously new tubing every time would be ideal, but if
Yes.
that's not the case, if we need to find tubing, what would work? What's good standard tubing?
We're going to be giving you the regular O2 tubing that's going to be able
Yes.
to connect these two long skinny lines.
Okay.
But
So
we're going to have to get you the valve that you connect them to,
Okay.
And we are gonna have to get you that exhalation valve off of another circuit.
Okay.
But
We'll
this
give
is
you
This is the
this
thing
is
that
the
we
thing
actually
that's
have to have.
important.
Yes.
And that one, because the alarm that was originally going off was because this is sensing the flow of the patient.
Yes.
And if it's not sensing it, it will keep giving 500 even if the patient's not truly getting 500.
Got it.
So that's why you need this and this.
Those two.
But we'll make
are
sure
very
every
important.
circuit has one. And then as far as this tubing goes, this is just basic like corrugated tubing.
Yes.
So they could just feed it on however works. But we'll give you some filters too. I'll give you some back filters
Okay.
to take so they could just switch about with patients.
Okay. Wonderful.
It'd be ideal if they could find a transport circuit for even some other vent
Yes.
that had at least that expiratory filter on it, not the filter, but sorry, the valve on it. And then if other hoses need to be adapted, then you still can.
Okay.
But
Yeah, because it's
That's
not
gonna
always going
be-
to have that same burn-in.
that's
Yeah,
gonna
you
be the
need
piece,
this.
yeah.
This is the important thing. that
Yeah,
you need.
something
Okay.
that has, it may not look exactly like this, but it has to have its own exhalation port.
Okay.
That's how it figures out how to turn on the volumes and
And I don't
stuff.
think I've ever seen any transport vent that doesn't have a circuit with an exhalation
Yes.
valve on it.
Okay, right. They all
some
have
sort of
something,
valve on
and
it.
this is just our little fake lung or the patient that would
Yeah.
be getting the air. Perfect. Wonderful.
Okay.
Okay, got everything.
So,
Wonderful. Thanks,
just on a
guys.
side note for you though.
Yes.